So as a Central Wisconsin native, growing up in the Marshfield clinic system, coming back and working as a pediatrician just felt like a really great fit, and it also let me tie in my love for kids and taking care of them. So I chose to become a pediatrician pretty early on, even before going into medical school, because kids are so much fun. Their energy, their laughter, the funny things that they say just keep you going. Certainly watching them grow through different developmental milestones and different stages is really fun and encouraging during your workday. So as a mom and a pediatrician, I can definitely relate to a lot of parental concerns and different characteristics that they discuss in their children. And it's certainly something in my parenting experience that we'll talk about and address if parents have concerns. As a pediatrician, well visits are very important for a variety of reasons for a child. At these visits, we will address developmental concerns, developmental milestones, look at a child's growth and make sure things are tracking appropriately. We can create a stronger relationship with a parent when we talk about parental concerns that they bring to a visit, and we'll also address immunizations and what a child's due for. So here at Marshfield Children's, not only do we provide care for physical growth and well-being, but we also look at various care for mental health issues and concerns. So during the pandemic, we've noticed an increase in the amount of anxiety and depression, especially among our adolescent patients. And these well visits provide an opportunity to reach out to those patients and their parents to help them address those concerns. A variety of different things that we discuss are how to communicate with your child with their symptoms, different referrals throughout the community, and then just as a pediatrician being there for families to support them as they go through that experience. When parents come in, we can definitely discuss different concerns that they have as children go through different phases of life with different mental health concerns, because certainly mental health is just as important as growth and development and other aspects of care. In addition, with well child visits, we can get children ready for back to school with any necessary immunizations they may need and provide their sports physical screening. So there's a great difference between symptoms in a child presenting with typical cold symptoms versus flu. So in a cold, a lot of times those symptoms are more slow to develop. Might develop some runny nose and congestion, followed by a cough, occasionally some low-grade fever. As opposed to someone with the flu, your symptoms tend to come on relatively quickly. High fever, body aches, chills, more fatigue. Generally, a child appears to be more run down and isn't quite acting themselves. So at well visits, when we talk about healthy eating habits, a lot of times we'll try to focus on one or two small choices that a family could make. For example, trying to reduce soda consumption or juice consumption, or trying to spend a little bit more time outside. Instead of trying to make all these changes at one time, and we tend to find that that works a little bit better for families and it's not as overwhelming. So my husband and I like to keep our family healthy. We really enjoy spending time outside with our kids, including going to the park, going for walks, playing in the water, things like that, just to keep us active and moving. When we're able to spend more time outside, we find that our kids are excited, they're happy, they're energized, and they tend to have a lot more energy and keep us going. As a mom with 2 young children and another one on the way, I certainly am experienced in the difficulties of raising young children. As a pediatrician, we want to be available to families to provide the support that they need as their children grow from infancy through the toddler years into adolescence, because we really view our patients as an extension of our family. So not only do we have the resources here at the pediatric offices in Wausau and Weston, we also have access to an entire network of pediatric care through the Marshfield Children's system. When you bring your child into the Marshfield Clinic pediatric office, you'll meet a wide variety of people who are looking out for the best interests of your child. So this includes myself and other providers, our support staff, including nurses and medical assistants and our secretarial people, and all of these people help provide the best care for your child. And we would not be able to get through our day or my own day without their support. Here at Marshfield Children's, it really is every kind of care for every kind of kid.